Hello, everyone. I hope that you all are doing fine. And yeah, we are meeting after so many days again. All right, so we need to start with this topic here from the TV, which we were discussing about dental management of patients with medical condition, and we are on this page 155. So we will start from antithrombotic drugs. So if any patient who is taking these drugs, how can we do their risk assessment that whether it is safe to proceed with the treatment or we may need to alter their doses. Okay, so first we need to start the properties of the antithrombotic drug. Later on, patient-related bleeding risk factor, then procedure-related, and the clinical effects of bleeding or thrombosis. All right, so with the drugs, firstly, the antithrombotic drugs are of various type. It could be antiplatelet or it could be anticoagulant. So anticoagulant could be the warfarin, which is vitamin K dependent coagulation factor, or it could be non-vitamin K antagonist oral anticoagulants, which is dabigatran. So in the scenario, patient might be taking any of the antiplatelet, which is clopidogrel, prasugrel, or aspirin, or dipyridamole. Okay, or he might be taking warfarin, which is an anticoagulant, and to measure the warfarin we need to undertake INR test. Okay, but it should not be relied on solely to determine the bleeding risk in patients taking warfarin. Other determinants of bleeding include concurrent drug therapy. For example, if the patient is taking warfarin and along with that he is also taking aspirin, which is the antiplatelet drug, so the risk of bleeding would increase, right? So if there are two drugs together the patient is taking and the other patient related factor that we will read in this box here. Okay, and your patient might be taking any other form of anticoagulant which are not vitamin K antagonist as of warfarin, which is dabigatran, and factor 10A inhibitors, which are apixaban or rivaroxaban. Okay, so unlike the INR in the warfarin therapy, there is no test to indicate the extent of anticoagulation in patient taking NOACs. Okay, so for the warfarin, we have INR test, but for these dabigatran and for the apixaban to measure the anticoagulant in their blood, we do not have any reliable test. Then the patient might be taking injectable anticoagulants, which is heparin and low molecular weight heparin, which is enoxaparin. They are usually prescribed for a shorter duration. Then patient-related bleeding risk factors. The list is not exhaustive, but additive risk of prolonged bleeding. So if the patient has one to three factors, then the risk would add on. Many complementary medicines can affect hemostasis either directly or through drug interaction. So consider stopping the complementary medication before the procedure. Then, what could be the patient related risk factor? First of all, if he has any problem with the elevated blood pressure, means he has hypertension. So, it is a risk that the chances of bleeding is more than the other person which does not have hypertension. Then the other risk factor could be the abnormal kidney or liver function, prior history of stroke, history of bleeding, pre-existing bleeding disorder, poor anticoagulant control. It means his INR is not stable. Then his old age or frailty and other drugs that predispose to bleeding. He is taking any other drugs, for example, NSAIDs or aspirin, or he had hazardous alcohol consumption, because that also make us prone for the increased bleeding risk. Okay, so we need to consider these risk factors. You just need to remember this. Just make any mnemonic for it, or just try any method that would help you in you know keeping these points in your mind, so that you can calculate how much is the risk in your patient of if you want to proceed with any treatment. Okay, so first point was hypertension, then kidney, liver function, prior history of stroke and history of bleeding, pre-existing bleeding disorder, poor anticoagulant control, old age, or he is taking any other drugs, or hazardous alcohol consumption. Okay, so if you first need to find out which drug he is taking, then you need to find out if patient has any of these risk factor in his medical history or in his general history. Then you need to consider which procedure are you going to do today for the patient. For example, the oral and dental procedure that are unlikely to cause any prolonged bleeding. For example, if you are just doing the exam. And diagnostic procedures, it means the periodontal examinations and the impression. It won't lead to any bleeding, so there is no need to do any alteration. Or if you are doing any restorative treatment, it means you are doing a filling or root canal therapy, because there is no blood involved in those procedures, so there would be no risk of any bleeding. Then the orthodontic treatment. So these three treatment, you just don't need to consider anything. You can just proceed with the procedure. But in the scenario, whenever they will give you the scenario, most likely they would give the procedure as extraction, because none of the other procedure does require any bleeding, does include any bleeding, and there won't be any much effect for you to consider. So generally they would give you the scenario that patient is taking this anticoagulant drug, and they will, for sure they will give you some of these risk factors, like maybe high blood pressure, or maybe he's taking aspirin, or he's old. Okay, so they will give you some risk factor from the patient history, and for the procedure most likely they would give you some extraction that you need to proceed, or you have proceeded with the extraction, and now what you can do if what you will do if there is any like bleeding, or if the socket is not healing, or whatever it is. Okay, so they have divided it into the two types, like the lower risk procedures and the higher risk. Lower risk procedure is extraction of a small number of teeth, which means if you are only extracting 1 to 3 teeth, and they should not be adjacent. If they would be adjacent, then the socket would be bigger, and that could lead to big bleeding problems. If you are doing periodontal procedures, for example, subgingival debridement, then there is a risk, but it is low risk. If you are doing any incision and drainage of swelling, it comes under lower risk. Or if there is any limited or small soft tissue biopsies. Higher risk would be larger number of teeth, or you are doing any surgeries, which as a general dentist you won't be doing, specialists would be doing that, or any extensive soft tissue biopsies. These things are also done by the specialist. So I believe that you will get a scenario of extracting one teeth, or maybe incision and drainage of swelling. So these would come under lower risk, but we need to consider other factors as well, which are present in the patient, or which type of drug he's taking, because you know that anticoagulant are more effective than the antiplatelet drugs. Management of patients taking antithrombotic drugs undergoing an oral or dental procedure. Okay, so here we were finding the risk. So risk we have concluded after getting to know their drugs, their body risk factor, and the procedure related risk factor. Now how we will manage them. The management of a patient taking antithrombotic therapy depends on the patient and the procedure related bleeding risk factor, and the type or combination of antithrombotic therapy they would be taking.
Clinical judgment is required for both the dentist and the clinician managing the antithrombotic drug to assess the risk associated with interrupting or continuing the antithrombotic therapy. So, if there is any need to interrupt or stop the medication, then you should discuss it with the patient's clinician, which is the patient's GP or the specialist, whoever has prescribed him those doses. Involve the patient in the decision. Then for specific advice on whether to continue or now we will read different scenarios and we will also study what we need to do in those cases. For example, if your patient is taking triple antithrombotic therapy, so if he is taking triple antithrombotic therapy, it means he would be taking dual antiplatelet drugs and one anticoagulant. In those cases, you won't be doing anything. You just need to consult their clinician managing the antibiotic therapy before performing any oral or dental procedure and consider specialist referral for the procedure. Before performing anything on them, you need to consult with their clinician, and the specialist would perform the procedure because there is an higher risk of bleeding in these patients. So you won't be touching these patients. Okay. Then the second one is patient taking an oral anticoagulant plus an antiplatelet. As I told you before, that the anticoagulant has more risk of causing the bleeding issues, or they have more power. So if the antiplatelet drug has power X, the oral anticoagulant has power 2X. So they are like that. So if the patient is taking these drugs, the advice applies to patients taking one anticoagulant and plus one antiplatelet. So anticoagulant might be any of these. So they would give you in the scenario that the patient is taking apixaban plus he is also taking the aspirin. So they will not give you anticoagulant plus antiplatelet. They will give you the name of drug. And these patients have a higher risk of prolonged bleeding because of the combination of antithrombotic drug use. Therefore, there is a lower threshold for considering temporary interruption of antithrombotic therapy in consultation with the medical practitioner or referring the patient to a specialist for the procedure. Okay, so there is a very low threshold that you because it also has very high risk but bit lower than the triple antithrombotic therapy, but it also comes under very a high level of risk. So you need to consider the patient related bleeding risk factor. This further increases the risk of prolonged bleeding. Okay, so if antithrombotic therapy has been prescribed for a specific duration, then you can delay the elective oral dental treatment until after this period is possible. Elective treatment is, for example, it is not emergency like regular scale and clean or any filling that you need to do that you can wait. Elective treatments are those treatments. So for patient taking an anticoagulant plus an antiplatelet drug, temporary interruption of antithrombotic therapy is not required for the following oral and dental procedure. Which procedure you can perform on these patients without any interruption is the unlikely. Which were the unlikely to cause bleeding? These ones only: the exam and the diagnostic procedure, restorative treatments, and the orthodontic treatments. Okay, but you need to consult the clinician for the patient for any procedure for lower risk or higher risk. If medical practitioner says that temporary interruption is required, you need to follow his advice. Okay, so for the triple antithrombotic therapy patient, we are not touching them. We are not doing anything on them. For these patients, we can do unlikely procedures, which means we can do the exam, we can do the filling, we can do the root canal, we can do the orthodontic treatment. Like Okay, but we cannot do any other treatment. Either it is lower risk or it is high risk. We cannot do it without consulting with their clinician. And if the medical practitioner says to stop the medication, we can stop it. And for the patient who, because here we are reading one anticoagulant, if the patient is taking warfarin as anticoagulant, we need to consider INR test as well. And the INR test should be done 24 hours before the procedure, provided the INR is 3.5 or less, then you can perform the procedure. Do not perform the procedure if the INR is more than 3.5, and refer the patient for medical assessment and stabilization of the INR. First, we need to stable his INR, then only we can perform the procedure. Otherwise, there is higher risk of bleeding. For a procedure performed in patients taking an anticoagulant plus an antiplatelet therapy, use local hemostatic measure. We will read these local hemostatic measure just in a while. I'm just trying to, explain these important points here because it would be very tricky for you if you are reading it for first time, because it does take a lot of energy for this topic. It is very confusing, but you need to understand, and I'm trying to make it simple for you as much as I can. But yeah, it is a tricky part, I do trust that. Okay, so now the patient is taking either a single oral anticoagulant or he is taking two antiplatelet therapy. So the risk is getting lower, right? From this one, this has like more risk, this has decreased, now it's lesser. Okay, so if the patient is taking, either he is only taking the single anticoagulant, which means he is taking warfarin, apixaban, or dabigatran, any of these, or he is taking two antiplatelet therapy, which means aspirin plus clopidogrel. Okay, so if that is the case, then we do not need to do any interruption in the procedures that are unlikely. Which were the unlikely ones? Examination, restoration, root canals, and the orthodontic. And in the lower risk of prolonged bleeding, but you need to make sure that there is no patient related risk factor. Which were the patient related risk factor? This chart. Okay, so for these patients, you can do these procedures, which are the lower risk of procedures, but you need to consider that there should not be any of these things present in the patient. Okay, if that is the case, if there is patient related risk factor or the higher risk of prolonged bleeding, then you need to consult their clinician and follow his advice on temporary interruption if required. And if patient is taking the warfarin, then you also need to check his INR, which should be done with 24 hours before the procedure, and the level should be 3.5 or less. Perform the procedure and do not perform the procedure if it is more than that, and refer the patient to the for the medical assessment and the stabilization of the INR. For procedure who you will perform, you will need to do the local hemostatic procedure. And for all these patients, you also need to advise the patient that there may have extensive bruising and to seek urgent medical advice or attention if there is persistent ooze or bleeding, and bleeding that restarts, or bleeding of concern. In any patient who are taking these blood thinners or who are taking these drugs, either anticoagulant or antiplatelet, you need to advise this line. Even here and even here, you need to give this advice. And for the triple antithrombotic or anticoagulant therapy, we are not doing anything, so we do not we are not touching the patient, so there is no need to advise this. But for any patient you are performing any procedure, you need to give the patient advice that do not get alarmed if there we are expecting extensive bruising, but you need to take urgent medical attention if there is any persistent ooze or any bleeding that restarts or any bleeding of concern. Now, if the patient is not taking any anticoagulant, he is only taking an single antiplatelet drug, which is maybe like he is only taking the aspirin or the clopidogrel or any of these. Okay, then you can directly perform all the procedure who are unlikely to increase the bleeding or the lower risk, whether there is patient related factor or no, you can perform the procedure. But for the higher risk, you need to consult. For the higher risk, as I mentioned earlier, these procedure you won't be doing as a general dentist. You would only consider these procedure as the main aim. So you can perform these procedures in the patient who are taking antiplatelet drugs. Okay, and because here the patient is not taking any anticoagulant, which is the warfarin, then there is no need to check the INR because there is no test for the antiplatelets. And also advise them about the bleeding issues. And if the patient is using an injectable anticoagulant undergoing an oral and dental procedure, then you need to delay elective procedure until after the anticoagulant therapy has stopped and refer patients to hospital for if there is any elective procedure, then you can wait, but if there is any emergency, you need to refer these patients to the hospital who are taking injectable. Okay, so if the patient is taking injectable anticoagulant, you are not doing anything. If the patient is taking single antiplatelet, you are doing everything, but only the higher risk procedure you cannot do. Okay, if the patient is taking either a single oral anticoagulant or the dual antiplatelet therapy, then you can perform unlikely and lower risk without the patient related risk factor. But if there is any patient related risk factor, then you need to consult the clinician. Okay. Now we will read this thing, which is consider specialist referral. So if you are considering the patient or you are referring the patient to the specialist, which specialist you need to refer, which is the oral and maxillofacial surgeon or the periodontist for patient with patient related risk factors or procedure with the higher risk of prolonged bleeding. For procedures of a longer duration, consider limiting the extent of surgery performed in one sitting or referring to a specialist. Okay, so then which are the local hemostatic measures that you need to do in patients taking antithrombotic drugs? First is apply pressure to the wound. When you take the tooth out, you just put the gauze there and you ask the patient to bite on it as hard as they can, because the pressure is the most important factor in achieving the hemostasis. Then if there is less tissue trauma, the healing would occur more pronounced, or it would occur easily as compared to a very traumatic site. You can also place cellulose or collagen. It would help in better healing. If there is any, you have manipulated the area a lot, you can also try to place some sutures that would help to ensure the closure of wound if indicated. So the pressure is the best thing that you need to do. These things are on addition, either the cellulose and collagen or the sutures. They are if indicated, because if you have done any surgical extraction, then you need to do the sutures, otherwise the healing would not be eventful. Then You can also consider the use of tranexamic acid 4.8% mouthwash as an adjunctive measure for patient taking warfarin. If your patient is taking warfarin and you have done the extraction, you can advise him to use the tranexamic acid 4.8% mouthwash as an adjunctive measure. Okay, but there is no evidence of the use of tranexamic acid mouthwash in patient taking NOACs, which is the dabigatran or the any other apixaban. How patient can use this mouthwash? Just before the surgery, after the procedure, give the patient tranexamic acid 4.8% mouthwash with instruction for use, which is 10 ml rinsed in the mouth for 2 minutes, then spat out 4 times daily for 2 days. Tranexamic acid 4.8% mouthwash can be compounded by a pharmacy, so you can just advise your patient to make the solution by themselves by crushing the tablets. It is essential to provide the patient with written information. Whenever we give the we do the extraction, we give the patient extra gauzes, and we also give the written instructions that they need to follow, because otherwise they might forget some things. But it is very important that they should remember and they should keep in mind. On post procedural care, including contact information in an emergency, you should also give your contact information and after hour number and where to contact if there is any emergency. Advise patient to seek, again this line here, advise patient to seek urgent medical attention if there is persistent ooze or bleeding that restarts or any bleeding of concerns. Advise patient that they may have extensive bruising. Paracetamol is the preferred analgesic, so it is very, very important that you understand that if the patient is taking antithrombotic drug, which could be antiplatelet or anticoagulant, you are not prescribing him any other painkiller. Paracetamol is the preferred analgesic. Okay, a concomitant use of NSAIDs and antithrombotic drugs, because NSAID also has the potential to increase the bleeding. So if you will prescribe the patient NSAID, it would increase the risk of bleeding. And also arrange a review dental appointment for 2 days after the procedure to check. What you will check into after a review appointment, you will check if there is any bleeding, if there is any pain, how is the healing going on, or if there is any infection at the site, and treat as necessary. Okay, so this is very important topic. You will for sure, you there would be one scenario on this topic. Okay, so I want you guys to read it again because it is too much of information. Okay, and once you will read it, I hopefully you will get an idea what they are trying to say here, because it is a tricky part. I do believe that. Okay, so yeah, so I will end the session here, and tomorrow we will start from corticosteroid topic. Thank you so much, guys, for watching my videos, and yeah, we'll see you in next one.